I'm Dr. Holly, and today we're going to be talking about how to tell imaging pathology on Nuc Med scans. This is a normal pediatric bone scan. And these are some examples of normal adult bone scans. On this bone scan of an adult, the dark spots on the ribs indicate rib fractures. In these bone scans of adults, the dark circular spots represent metastatic disease. In this bone scan, the dark region on the left leg shows Paget's disease. In this bone scan, the dark region of the lower left leg shows signs of Paget's disease, which is a disease having to do with bone formation. Here is another bone scan showing Paget's disease in the leg. Can you tell which leg it is? Here is yet another example of Paget's disease. This patient has it in his head, arm, and leg regions. In this bone scan, the patient has an osteosarcoma of the right tibia. Here is an example of a normal lung scan. The lung scan includes two separate scans, one during lung perfusion and one during lung ventilation. In this lung scan, there is a pulmonary embolism in the periphery of the left lung. Lung scan, there is a pulmonary embolism in the posterior aspect of the right lung. Here we have an example of a normal myocardial perfusion scan. These scans demonstrate blood flow through the myocardium. There are two scans done, one during stress and one during rest. In this myocardial perfusion scan, you can see an inferior wall myocardial infarction.
She said infarction.
This scan shows a patient with an enlarged heart. This guy went too many times through the McDonald's drive-thru. Boom, boom, boom. This is a normal hepatobiliary scan, or HIDA scan. H-I-D-A. This HIDA scan is a functional study where they take scans in 5-minute intervals. This scan shows an enlarged gallbladder in comparison to the tiny liver. This HIDA scan shows an enlarged liver with possible common bile duct obstruction. Here we have a normal gastric emptying scan. It is a time flow study where you can see the progression of the radioisotope from the stomach through the bowel. In this gastric emptying scan, we can conclude that the patient has gastroparesis. As you can see, the radioisotope isn't going anywhere. This is a normal renal scan of the functional phase. As you can see, the radioisotope going from the kidneys to the ureters down into the bladder. This is another part of the renal scan showing the immediate phase. This scan is also normal. It showcases the ability of the kidneys to uptake the radioisotope. In this renal scan of the functional phase, you can see the right kidney atrophy. Obviously, the right kidney is the one that is not visualized on the scan. This renal scan of the functional phase, we can see that the patient has polycystic kidney disease. In this renal scan of the functional phase, we can see that the left kidney is enlarged while the right kidney is diminished. This renal scan of the immediate phase, we can see that the right kidney has a case of hydronephrosis. What I have here is a brain death study used on patients in comas to see if they have any viability in their brain. In this study, we can see there is no blood flow in the patient's brain, causing me to believe that the patient is indeed brain dead. On the other hand, in this brain death study, we can see the patient has some blood flow. Hence, they are not brain dead. Here we have a sentinel node scan. In this scan, you can see that 2 nodes are detected in the breast region. I'm Dr. Holly. And thank you for learning with me today. I'm Dr. Holly. I'm Dr. Holly. Thank you for learning with me today. Hi! This is a little creepy. I love cheddar. Do you love cheddar?